a lot of the services that are here today were around at that time, but there were fewer services. They were dreadfully poorly funded. The resources that they had to hand were pretty minimal. They were largely around Perth. A large proportion of the services were delivered by government services. And there was a fractious relationship at times, sometimes quite often, between the funders and the services. And I think the services were probably more competitive with each other because the funding was so sparse and the funding terms were so short that it made for a more competitive and less collegiate and collaborative situation. But there was enormous passion. There was enormous personal investment from people, both in government and in the not-for-profit sector. And over a short period of time, there were one or two individuals who really worked, people in WANADA, people in the government services, who really tried to build and nurture the field. And I think that distinguishes, for me anyway, that distinguished Western Australia from many of the other places in Australia. There were people who worked through that competitiveness, and many of those people are still around working in the field today. The collaboration and cohesion that we have now has been driven by people in the government sector, but mostly it's been driven by people in the not-for-profit sector. And it's certainly been driven by WANADA. We see, we didn't used to see as much of a single voice in the past. We see a much more cohesive voice. We see much stronger advocacy for the sector, but also for the people that we seek to serve, for the West Australian community. And I think that has changed substantially, and we need to maintain that. It needs to be a core part of what WANADA is about and what WANADA does and what the whole sector does. Another fundamental challenge in relation to policies to ensure that health, the health of the community, the health of individuals is what drives our responses to drug use and drug-related harm. And we've far too long relied on a discriminatory approach, on an approach that criminalizes people, and that just has failed to improve the quality of life for Australians generally, and it's certainly failed in relation to people who are affected by drug use and drug harm. So we must do more to humanize our perception of drug use. We must ensure that we offer dignity and respect, the same dignity and respect we would offer anyone else who might experience challenges in their life, where people do experience challenges. And we must have a non-discriminatory access to support and help when it's needed. And that means drive it with health, but maintain the humanity and address stigma and discrimination. We need to rise more effectively to commercial and vested interests that drive public health responses to pharmaceutical drugs, to tobacco and to alcohol, and that we support the community to ensure that public health responses are driven by public health evidence, not by commercial and vested interests. There's far more people in the community recognise the humanity of the area in which we work, and I think that did change for the better in the 1990s. Doesn't mean we're there yet. We're a long way from being where we should be, but I think we've seen an increase in the perception that alcohol could be a problem for people, not just those who are alcohol dependent. Not across the whole community, but it's certainly changed. I think we saw a change in relation to the willingness to accept what previously were challenging responses in relation to overdose in the 1990s, and that was driven essentially by consumers and their families. I think we've seen a media that is better in relation to alcohol and other drugs. Are we there yet? No, we've a long way to go. And I think we've seen a recognition of things like the fetal alcohol spectrum disorder and the importance of responding to there. I think we've seen a stronger voice in relation to Aboriginal health and well-being, and that's improved dramatically. And I think we used to have largely city-centric services across Australia, and Perth wasn't any different. I think we've seen an improvement in services across regional and remote Western Australia. Again, we're still a long way to go, but I think there has been an improvement. We need to maintain that over time. We need to ensure that funding is secure, that funding is longer term, so that we can recruit and retain the best people in this field and ensure that they have a quality of working life to develop their skills and to provide care for others. If we treated our healthcare services in government healthcare services in the same way that we sometimes treat our not-for-profit services, we would perhaps see poorer outcomes when staff can only get 1 or 2 year or 3 year contracts, when after 2 or 3 years people have to devote an enormous amount of time and energy to competing with others. Should services be held accountable for quality service and be accountable for accepted standards based on evidence? Yes, they should. Should they scrabble over small amounts of money? No, that's not going to build cohesion, it's not going to build growth, it's not going to retain staff, and it's not going to create collaborative healthcare system for people affected by alcohol and other drug use. So that is a key challenge. One of the things that I think we've made some advances in is in relation to engagement with Aboriginal people and Aboriginal communities. Obviously, it falls to those people, those communities to voice their thoughts about where we've been and where we've got to and where we should be going. The challenge remains. We need only look at the disadvantage that many communities experience, the discrimination that many Aboriginal people face. But I think that has been a real powerful lesson, that if we want to make a difference in Aboriginal communities and for Aboriginal people, then that's led by Aboriginal people. That has Aboriginal people's voice right at the forefront, and that we draw on the incredible experience, the incredible capability, and the incredible leadership that members of the community and elders in those communities can provide. It is important to recognise the huge influence that WANADA and its membership have had in policy debate and development in this state. In the early 2000s, we had a drug summit where 100 people from diverse backgrounds, communities, services, government services were brought together. People whose families had been affected by drug use, people in the prison system, brought together to debate what we should be doing in relation to drug policy, drug strategy, what we should be doing in relation to better access to treatment, how we should structure the service system so that it better met the needs of individuals, how we addressed the laws around cannabis use and cannabis possession. And it had a huge impact on the community that resonates today. But more recently, we could look at the work that WANADA has done in relation to the recent governance review. And out of that, the various consultations, the representations of individual members and of WANADA as a body to government and to the people conducting the review, resulted in the drug and alcohol sector coming out with a stronger identity, recognition of its particular needs, wants and directions. And I think we shouldn't forget those sorts of roles, various parliamentary inquiries. And it's really important to ensure we've got a strong voice, that we've got a coherent voice, and that we've got a combined voice, recognizing sometimes there'll be differences. And that has been done, I think, through the board of WANADA and the membership of WANADA and the staff of WANADA, helping bring the field together to have that strong voice heard. And that must continue.